We're conducting a study looking at pylon loads, so the amount of force that's being carried in a prosthetic leg. And this is thanks to some support from the Maggie Neumann Health Sciences Research Fund.
The goal is to make a device that can help amputees adjust to their prosthetic and really understand how much weight am I putting on it. Right now, the only time that they know if something's wrong is if they're in pain. So we tried to create a design using the pressure sensors created by Higginson a few years ago to see, can we apply this to the prosthetic.
We're going to basically put the sensor inside of the socket, and then on the treadmill we'll be able to identify if the sensor is giving the same feedback, essentially, so that we can qualify that it's working properly.
We want to monitor limb loads in especially individuals with lower limb amputation to determine whether they're being loaded symmetrically, whether they're overloading over time, and also to make sure that they're using their limb optimally. We think that this is also going to provide a really useful tool when someone's learning to use a new prosthesis or trying a new activity with time, like starting to run on your prosthesis, to monitor how well you're loading, again, whether you're loading symmetrically.
This would be able to provide validation for insurance purposes, showing that people are using their prosthetic. The conversation that we have clinically with patients, sometimes it's really tough to translate what the patient's trying to express what they're feeling in terms of what's really happening. Whereas obviously if you have some hardcore data, you can use that to have more of a direct understanding of what's happening and less guessing.
We start this process with an unmet need, and it's identifying the need in the community. And honestly, this project has happened really organically. Mr. Horn had approached us a number of years ago when we had a similar kind of force sensing device inserted in an orthopedic boot for individuals who had had an Achilles tendon rupture.
And it's pretty interesting now to literally see it being compact and being able to be utilized in a prosthetic.
Being able to pivot and apply your engineering skills to address a novel problem is, I think, why a lot of us are drawn to this field. Being able to impact human health is kind of our primary goal.
One of the things that excites me is to know that, okay, whatever thing that we are doing has a long way to impact the lives of such individuals. This, moving forward, would really cause a change in their lives.
We come with clinical issues all the time, and we don't know what to do with them. But we have this awesome tap of resources where we're able to come into a biomechanics lab and say, these are the issues that we're experiencing, and then this is exactly what the translation is. Researching it, figuring out how it can become clinically relevant, and we can incorporate it. Most people do not have access to University of Delaware facilities like we happen to have the luxury of having, and it's like, okay, how do we make that more practical for an industry that's going to be able to help and impact a lot more people?